this article that published in European Journal of Case Reports in Internal Medicine, they were assessing the deep vein thrombosis and pulmonary embolism as two complications of COVID-19 pneumonia. And they were talking about the most common symptoms of COVID-19, which would be fever and cough, which can progress to pneumonia, acute respiratory distress syndrome, ARDS, and or end organ failure. Risk factors associated with ARDS and death are older age, comorbidities such as hypertension and diabetes and hyperlipidemia, neutrophilia, and organ and coagulation dysfunction. Disseminated intravascular coagulation, DIC, and coagulopathy can contribute to death. Anticoagulant treatment is associated with decreased mortality in severe COVID-19 pneumonia. VTE, which is venous thromboembolism, is a significant cause of morbidity and mortality in patients with COVID-19. Risk factors include older age, immobilization, obesity, smoking, and hospitalization. COVID-19 patients frequently complain of severe asthenia, fatigue, and consequently inactivity, even at the beginning of the infection. In addition, risk factors for VTE, which is venous thromboembolism, include hypoxia and sepsis, which are two common features of COVID-19. Therefore, anticoagulant treatment is associated with decreased mortality in severe COVID-19 pneumonia. D-dimer is a laboratory index to diagnose venous thromboembolism, but not in COVID-19 because it is generally increased. So most patients with COVID-19 who are hospitalized, they have high levels of D-dimer already in their blood. Particularly in severe COVID-19 pneumonia, and is associated with the development of ARDS, which is adult respiratory distress syndrome, and progression from ARDS to death. Then the authors say, based on all this evidence, if there are clinical signs and symptoms or suspicion of venous thromboembolism, compressed ultrasound and echocardiography should always be performed, irrespective of disease stage. Our findings suggest that patients with COVID-19 pneumonia should be investigated for VTE, even if treated with low molecular weight heparin. Both these patients here seem to be at risk of VTE, even in the absence of hypoxia and severe respiratory failure. And it is clear VTE, venous thromboembolism, can increase the risk of death in COVID-19 patients. So they concluded that low molecular weight heparin therapy at the prophylactic dose should be carefully considered in all patients with COVID-19 pneumonia for a longer period than required for clinical resolution of the disease. Therefore, taking a mild anticoagulant, especially when it comes from the fruit sources or natural sources, is recommended in patients who are tested positive for COVID-19 or in people who are not positive for COVID-19 is strongly recommended during this pandemic. Amla or Umbilica officinalis fruit has traditionally been considered as a cardiovascular medication and has demonstrated remarkable cardiovascular effects in the pharmacological literature. This study is a systematic review, which means it actually reviewed multiple randomized control trial, and this study systematically reviews Umbilica officinalis potential for prevention and therapy of cardiovascular disease. So they reviewed multiple RCTs, which is randomized control trial, in highly respected database such as PubMed and Cochrane database and some other database. From 1966 to 2017 on Umbilica officinalis fruit effects on cardiovascular system. After reviewing 19 articles concerning the cardiovascular pharmacological effects of Amla or EO, they found that the plant has shown anti-atherogenic, anticoagulant, hypolipidemic, antihypertensive, antioxidant, and antiplatelet and vasodilatory effects, as well as lipid deposition inhibitory properties. Moreover, it prevents from the cardiotoxicity from doxorubicin and isoprotrenol, which is two pharmaceuticals, on the myocardial ischemia and reperfusion injury, and improve vascular endothelial function in animal studies. As you may remember from my past videos, SARS-CoV-2 can damage the endothelial cells and create a hypercoagulation state. So according to this article, if we have some repairing effect from this Amla fruit, that would be great for endothelial damage as well. Also, some high-quality clinical studies report vasodilatory and myocardial antioxidant properties as well as antiplatelet aggregation effects of this great plant. Amla fruit and anti-clotting without the bleeding. Amla may not have as extreme effects on blood clotting as aspirin, but the greenish fruit seems to hold one advantage while modestly reducing blood clots, a lower risk of inducing bleeding. In a crossover trial on Amla extract and blood clots, researchers assigned type 2 diabetes to a daily dose of Amla extract, aspirin or clopidogrel, which is Plavix, for 10 days. Amla extract was associated with a 36% reduction in platelet aggregation or blood clotting, but drugs provided upwards of 50% reduced blood clotting, but the greater chance of bleeding. And greater reduction might not be ideal. Multiple studies, including a large cohort published in the European Heart Journal, suggest a connection between platelet reductions, anti-clotting drugs, and bleeding events. So my recommendation for patients who tested positive for COVID-19 is to take 1 teaspoon of Amla fruit in 1 cup of water or juice or their smoothie prophylactically. And in patients with chronic diseases such as hypertension, diabetes mellitus type 2, cardiovascular disease, or obesity, also 1 to 3 teaspoons of Amla fruit in a cup of water could really help them with cardiovascular system. Also, in healthy people, taking 1 teaspoon of Amla fruit in 1 cup of water could actually bring the healthy cardiovascular system. Also, they can actually balance the lipid profile for them. Thanks for watching. I hope you enjoyed this video. If you like this video, please like, share, and subscribe. Hope to see you in my next videos.